Good day, class. Today we're going to discuss about acute chronic blood loss anemia. So before we start, I will going to discuss to you the objectives of this video. Acute blood loss anemia. Describe the etiology and the physiology of acute blood loss. Explain the significant hematological laboratory findings in acute blood loss. Chronic blood loss. Describe the etiology and the physiology of chronic blood loss. Explain the significant hematological laboratory findings in chronic blood loss. What is acute blood loss anemia? It's a sudden reduction in the oxygen carrying capacity of the blood. Etiology. The acute loss of blood is usually associated with traumatic condition such as an accident or severe injury. Occasionally, acute blood loss may occur during or after surgery. Physiology. An acute blood loss does not produce an immediate anemia. A severe hemorrhage or rapid blood loss amounting to more than 20% of the circulating blood volume reduces an individual's total blood loss and produces a condition of shock and related cardiovascular problems. Even if enough hemoglobin remains in the circulation, an oxygen impairment can exist because of the circulatory failure. However, severe acute bleeding can be fatal as a result of the collapse of the circulatory system. Immediate expansion of the blood volume is required. So here is the clinical features of acute hemorrhage in healthy young adults. So as you can see, uh, there is few or none symptoms if there is 500 to 1000 ml of blood loss. At recent or asymptomatic if it is 1000 to 1500 ml of blood is lost. And so forth. So please read on the symptoms and the amount of blood loss corresponding to it. In acute blood loss, the body itself adjusts to the situation by expanding the circulatory volume, which produces a subsequent anemia. Fluid from the extravascular spaces enters the blood circulation and has a diluting effect on the remaining cells. So the laboratory findings. Hematological findings are very different in the patient who has experienced an acute bleeding episode within the past 24 to 48 hours compared with the patient who has suffered from chronic bleeding for several months. The earliest hematological changes in acute blood loss is a transient fall of the platelet count, which may rise to elevated levels within 1 hour. The next change is the development of neutrophilic leukocytosis. So, it is from 10 to 35 times 10 to the ninth power per liter with a shift to the left. So, there is an uh, immaturation, immature production of uh, neutrophil in the circulation because there is a shift to the left. Hemoglobin and hematocrit do not fall immediately, but fall as tissue fluids move into the blood circulation. It can be 48 or 72 hours after hemorrhage until the full extent of the red cell loss is apparent. Assuming that the patient with acute bleeding was healthy before the episode, the peripheral blood at 24 hours. So the blood picture, so within the 24 hours, it should be normochromic and normocytic. with normal red blood cell indices, the mean corpuscular volume or the mean cell volume, mean corpuscular hemoglobin or the MCH or mean cell volume, and the mean corpuscular hemoglobin concentration or the mean cell hemoglobin concentration. When an increased number of reticulocytes reach the circulating blood because of the increased erythropoiesis. So there is an increased reticulocyte because there is an increased erythropoiesis. A transient macrocytosis develop. This phenomenon takes place beginning the approximately 3 to 5 days after the blood loss and reaches a maximum approximately 10 days later. It takes about 2 to 4 days after blood loss for the total WBC count to return to normal and about 2 weeks for the morphological changes to disappear. The return of red blood profile to previous values takes longer. So please take note on the differences between the acute blood loss anemia and the chronic blood loss anemia. Acute blood loss anemia, it takes only 24 hours or 48 hours. So the etiology is trauma, surgery, and accident. Blood volume disruption. So there is a blood volume disruption. There is no iron deficiency. The hematocrit or the packed cell volume is usually normal. The WBC and the platelet is increased because there is a shift to the left and there is a the platelet count will elevated within 1 hour. The reticulocyte is normal because there is a release of erythropoietin. However, if there is an increased erythropoiesis, there is a transient macrocytosis development. It takes about 2 to 4 days after the blood loss for the total WBC count to return to normal and about 2 weeks for the morphological changes to disappear. The return of the red blood cell profile to previous values takes longer. Chronic blood loss anemia. It is a loss of red blood cells through bleeding exceeds production of new red blood cells. So even if nagproduce ang RBC ng blood, there is still a gradual loss of red blood cell. Etiology. Chronic blood loss is frequently associated with disorder of gastrointestinal tract. Although chronic blood loss may be related to heavy menstruation in women or urinary tract abnormalities, in chronic anemias, blood loss of small amount occurs over an extended period, usually months. Chronic and continuous of small volumes of blood does not disrupt blood volume. If blood is small amount over the extended period, both the clinical and the hematological features seen in acute bleeding are absent. Regeneration of RBC occurs at a slower rate. The reticulocyte count may be normal or only slightly increased. Unnoticeable anemia does not usually develop until after storage iron is depleted. Again, there is no noticeable anemia if does not usually develop after storage iron is depleted or decreased. At first, the anemia is normochromic and normocytic. Gradually, the chronic bleeding results in an iron deficiency and newly formed cells are morphologically hypochromic and microcytic. The WBC count is normal or slightly increased. Platelets are commonly increased and or later in severe iron deficiency are they likely to be decreased. So there are note hypochromic and microcytic gradually it will result in an iron deficiency because there is a iron deficiency in chronic anemia. So again, let's see, the WBC count is normal or slightly decreased. The platelets are commonly increased, and only later in severe iron deficiency are they likely to be decreased. So let's see the differences between the acute and chronic blood loss. Let's now focus on the chronic blood loss. So etiology is GI tract, menstruation, and urinary tract, blood volume disruption, and there is no blood volume disruption. There is a iron deficiency, that there is a decreased hematocrit, normal platelet and WBC count, and there is an increased reticulocytes. So, for this chapter, acute blood loss is usually associated with traumatic condition during or after surgery. It does not produce an immediate anemia. A severe hemorrhage reduces an individual's total blood volume and can be fatal because of the collapse of circulatory system. In acute blood loss, the body attempts to adjust to the situation by expanding the circulatory volume, which produces the subsequent anemia. Fluid from the extravascular spaces enter the blood circulation and has a diluting effect on the remaining cell. The earliest hematological changes in acute blood loss is transient fall in the platelet count, which may rise to the elevated levels within 1 hour. The next changes is the development of the neutrophilic leukocytosis with a shift to the left. The hemoglobin and hematocrit does not fall immediately. It can be 48 or 72 hours after the hemorrhage until the full extent of the red cell loss is apparent. Chronic blood loss lacks both clinical and hematological features seen in acute bleeding. A noticeable anemia does not usually develop after or until after storage iron is depleted. In time, the peripheral blood smear becomes hypochromic and microcytic. So, thank you for listening and God bless all. Afterwards, in this discussion, we have a quiz. This quiz will be just acute and chronic blood loss. Uh, I will be discussing next meeting the iron metabolism, the deficiency in some of the anemias. Thank you and God bless again.